Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and every single thing in between. I'm your host, Sybil Amuti, and I'm so excited because I'm here with a bite-sized piece of my heart co-host, Miss Dylan Kyle Amuti.
Hi.
Hey, girl, how are you?
Good.
You know what? This is our first time actually being on the podcast together. How does it feel?
Good.
Yeah? How are you dealing with homeschooling?
It's fun because, thank you to the teachers, they actually have meetings, and now we don't have any school and then next week is spring break. So,
So you're happy about
yes.
that? Okay. But how are you dealing with being home every day, not really leaving the house except to go for a walk and not seeing your friends every day?
I can just call them. It doesn't really matter.
Yeah?
Yeah.
Wow. Why is it that mommy is itching to get out and see friends?
I don't know.
Well, Dylan and I want to thank all of the professionals that are out working on our behalf, on your behalf, around the world, really, to come up with some solutions to support us getting into a new stage of life after COVID, because this will eventually have to evolve and we will have to move forward. Right, Dilly?
Yes.
She's giving me this strange look, guys, because we have a game going on in our house where we can't say the name of the actual virus, and I just said it, so I do officially owe her $1. But
You owe more than $1.
well, I owe $1 for what I just did, but I do owe like $20. But anyway, in other news, my co-host and I are excited because today we're bringing forward a medical conversation with Dr. Dianah Lake, who is an emergency room practitioner. She is on the front line of this virus, and she can really speak to some of the practical things that we may or may not know that we should be doing. There's a lot of rumors about should we be taking elderberry or not. That gets answered in this podcast, along with other helpful questions and solutions. And for every single mom, parent, or person that's out there working from home and trying to figure out the day-to-day of this routine, please do with my entire heart. I ask that you protect your mental health. Do what's essential to keep your peace, your balance, your wellness in check. Make sure you're taking time for yourself, implementing self-care every day, and increasing the quality of the time that we all spend together. So that's been helpful, right, Bunny?
Yeah.
Anything else you want to say to the great girlfriends before we hand them off to Dr. Dianah?
I don't know.
She doesn't know. Okay. Well, without any further ado, we're going to head into this week's episode, which is a pre-recorded conversation between myself and Dr. Dianah Lake. She is fine wine. She is fitness goals. She's body goals and wellness goals. And so I couldn't think of a better person to really speak to this, Dr. Dianah. So thank you. First of all, thank you for the work that you're doing every day, but particularly during this time frame where doctors I know are really pressed.
Yes, we are.
So how are you mentally? How are you?
I've had my ups and downs for sure. But, in the Great Girlfriends group, we talk about gratitude a lot. And that's a practice that I've been doing before this, but I'm really honing in on it and really practicing that every day. So that's helping with just being stable and grounded and being able to go into the ER and do my work and protect myself, but be grateful for what I have. And so it's really helping to keep me grounded. But it's an up and down thing. I've cried many days going into work. Yeah.
So can you tell us a little bit about what you're seeing when you go into work?
So it's been sort of a wave because we're about 2 weeks full, 2 or 3 weeks full into this now with the coronavirus, pandemic, at least here, in the United States. The first week, we were seeing a lot of people just hysteria, right? A lot of people were just coming in confused, anxious, worried, not knowing if they had whether their cold symptoms was actually symptoms of COVID-19. So we were just inundated. The ERs were just full. People were just flooding the ERs with questions and concern. So it was difficult. And we have sick people mixing with not sick people, and everybody was just in the waiting room. And that was scary for us. So then we had to start creating, policies in some kind of way, to sort of separate the truly sick people from the people that are just worried, from the people who are critical for other reasons, like a heart attack, a stroke, and, so we had to start creating ways of just determining early on who needed to go where. And so it's kind of progressed from that week. That was like 3 weeks ago. And then when we started really pushing the social distancing, hey, stay home. And then all of the schools got closed and businesses started, all the different, the bars got closed. I think people started to really get the sense that this is not a game. This is serious. And if these people, the medical, professionals who are experts, who have spent years and years educating themselves to know this stuff, are telling me to stay home, I need to stay my butt home.
Yes.
And people really started to get it. And so now we're seeing that less people are coming in just worried and in hysteria. We're seeing the people who are truly sick coming, and people who have had contact with someone who they know is positive. So it's a different wave of people that are coming in now.
So tell us what's true about COVID-19 and what's false.
Well, I think the biggest misconception that the public is having is, this is just a bad case of like the flu, which is not.
Okay.
Now, majority of the people who will get COVID-19 will recover. Okay. I have some statistics here for you guys. Hey, Antoinette, I have some statistics here for you guys. So right now, 468,354 positive cases. This is a underrepresentation, I must say. Okay. The 468,000. So the number is 468,354 positive cases. That is highly, highly underrepresented. Because remember, 3 weeks ago, many people weren't getting tested. There were no kits. There were nowhere. So people were positive then, and they never got tested, and they just weathered it at home, right? So this number is just what we know. There's like thousands of more people that we don't know about who never got tested.
Okay.
And now we've got 21,181 deaths that are recorded as of now, today.
Wow.
And we've got, this is the good news. The good news is 113,812 people have recovered.
Wow. Okay.
Yeah. So out of that 468,000 positive, 113 have fully recovered. So that's great news that we should be flashing out there.
Yes.
So, right? Because that's the positive spin.
Yeah.
The news is not going to give you the positive spin, of course. They want you to be in fear. That's what I feel like. They just push the scary parts of it. But many people who are healthy, many people who have no medical conditions, who come in contact with this virus, most likely are going to do okay in the long run, right? It may take 3 weeks, 4 weeks for them to recover. But if they have no chronic medical diseases, if they have no lung issue before getting it, they should do okay, right?
Okay.
And so I think one of the myths that people are going around thinking is that COVID is just a bad case of the flu. It's not. Okay. The mortality rate of COVID in Italy is up to 9%. That's really high. So let me tell you the difference. So the flu in the United States, the death rate of the flu every year is 0.1%. I know I'm getting all technical here.
No, this is good.
Yeah. So the flu is 0.1% death rate in the United States every year. In Italy, COVID-19 is killing 9% of the people who get it.
Jeez.
That's 90-fold.
Yeah.
Okay. 9% is 90 times 0.1%. So that's a pretty high death rate considering what the amount of people who die from the flu.
Mm-hmm.
right? So that's 90 times more people that are dying from COVID. That's why we are so aggressive with the prevention of it,
Mm-hmm.
because we would rather you not have it than have you have it and have to be treated, because if you have chronic asthma, if you have emphysema, if you have, if you're a cancer patient, HIV patient, someone on chronic steroids, that your immune system is low, any condition, if you've got history of heart disease, you know what I mean? If you have history of anything that reduces your immunity, you're at a much higher risk. Do you know what I mean? So we're
Yeah.
trying to prevent you from getting it in the first place so that you don't end up being a fatality.
Mm. So that's it. And I think that, one of the things that I'm observing, even my husband was saying, he was at the post office the other day and there was a doctor there who was just, pleading with people to please make sure that they were safe in their communities, that they practice social distancing, because of
Mm-hmm.
the things that he's seeing that we don't know anything about. And he prays that we would never be exposed to just the mass response in the hospitals and people not being able to do or manage, their condition based off of the issues that you guys are seeing in the hospital. So I know from the medical side, you guys know and are seeing way more than we're seeing, and you also understand more about the urgency for us to really be safe and really practice safety. I think people are still trying to manage the idea that life at home is a reality for us right now. But could you
Yes.
kind of speak to the idea that the sooner we practice this distancing and practice containment, the better, the more likely we are to have a better summer, a free summer.
Absolutely. Yes. So this is the thing, okay? The whole idea of social distancing came from what we've learned from the other countries.
Mm-hmm.
So Taiwan was robust with their social distancing, giving everyone masks, just really, they've learned from China. Taiwan is right next to China, right? They're very close. They saw what was happening in China and they were like, listen, we need to get on it. And
Yeah.
so Taiwan, I mean, they had like less than 100 deaths
Wow.
in Taiwan, and they were able to quickly contain the COVID infection in their community because they were just so robust with the social distancing, and people listened. People followed the instructions of the
Yeah.
medical community. Whereas here, people were still in bars on St. Patrick's Day, dancing around, and carrying on when we were saying, listen, we need you to be home. The
Mm-hmm.
reason New York City is so inundated with it right now is the same reason.
Mm-hmm. Mm-hmm. Mm-hmm.
People haven't been adhering to the social distancing. You see, I don't know if you heard about Westport, Connecticut. Did you hear about
No.
the community? Well, apparently, I've read a couple of stories about it where there was a party, and the person who hosted the party invited 50 people to the party on March 5th.
Mm-hmm.
And within 4 days, multiple people were showing signs and symptoms of COVID from that party.
Wow.
And they brought
Wow.
38, they brought 38 of those people back once they realized there was an outbreak in the town, and over 50% of those 38 people got positive results. So from one
Jeez.
person having the virus at a party, all of those people were exposed. And then they left not knowing they were exposed and went to New York. One of the people who was the first to be tested went to Johannesburg on a plane, not
Just like
knowing he
that.
was infected. And just within a week, those 50 people had gone so many different places. One guy had gone to a convention. So he was just walking around,
Oh
you
my
know,
gosh.
and so if you don't know and you're going to new places and introducing your breath and your
Yeah.
cough and
Yeah.
your sneeze to other people, that's how it goes so quickly and it spreads. So now Connecticut is like on lockdown because of this issue.
Mm-hmm.
I even got called 4 times today by recruiters asking me if I can go to Connecticut to work because
Wow.
they need doctors in Connecticut. They're even taking doctors in Connecticut right now who are not licensed in Connecticut. That's how
Wow.
serious it is. They're saying, we don't care if you're licensed. We need you to come and work.
My God.
I don't.
So,
Did you see the gravity of what I'm
yes.
talking about? Yeah.
Yes. So, in terms of, I mean, some of the things that we're doing, right? So we are going to the grocery store as little as possible, but we're coming into contact with people and we're coming in from the grocery store and we've got groceries and they've been touched. And,
Yes.
tell us what should we be doing in terms of keeping it from entering our homes when we are, out, you are doing distancing, right? But you're still touching a lot of things that everyone's coming to contact with. So what are some things that we should be considering, when we do go out for our small, moments of fresh air?
Right. So the biggest thing is the hand washing, which you've heard everyone say the hand washing. So soap and water is going to cleanse your hands of viruses in general, right?
Mhm.
Soap and water, basic old school soap and water. I prefer soap and water over the hand sanitizers anyway. That's just been my practice in medicine all these years. But if you don't have access to soap and water, like immediately, you can use a hand sanitizer that has at least 60 to 70% alcohol in it to sanitize your hands. Now, you want to also get your doorknobs. You want to wipe your car door. You want to wipe your steering wheel. You want to wipe your shift in your car. You want to keep all your surfaces in your car clean. And then just backtrack basically, right? So when you get home, you're going to wash your hands, and what I've been doing as far as fruits and things, I've been getting things that have a peel on it, so like bananas where you actually can peel that part that other people have touched off, right? Things that have a peeling on it that can come off and the fruit is actually on the lower layer inside.
Yeah.
So I've been sticking to that. And I've also been getting some of the things that are already like the fruit, the dole has fruit cups that are non-GMO. So I've been going with those because it's already packaged, it's wrapped, so you don't have to even worry about touching it. You can just open the cup and the fruit is inside. Right.
Okay.
And it's in like fruit juice. It's not like sugary or, anything like that. So I'm going with those. So that I'm not getting things that people are touching because there's just no way to tell.
Yeah.
Even if you wash it, that is, that you're going to get, all the virus or anything that's on there off. So I'm going with things that are already packaged, where I don't have to worry about people touching, and then fruits or produce that has some kind of layer that you peel off.
So I've got a question here from Kimberly out of New Jersey who says, should we wear masks in public? I've been doing the gloves, but not the mask. What would you recommend? And I want to say too, I went out today and so many people had masks and I was like, I thought we were out of masks. I'm wondering where everybody's getting these masks from. And I used a scarf. But I'm just kind of curious, have we gotten a fresh supply of masks that I don't know about? And and also Kimberly's question, should we do the mask in public?
So the reason that people will wear a mask is if they're in very close quarters with other people who are sick. So the idea is you want the distancing to be 6 feet. Okay. So you want 6 feet of distance from people in the public. So, if you go to the supermarket and you're in line, somebody may be about 2 or 3 feet behind you. So you can't always, distance yourself to have the 6 feet, but you can maneuver your way in the supermarket, right? Like when I went to the supermarket today, I looked for one of those self checkout things that did not have anyone near it. And so I just went straight to that one. I paid for my stuff and I left. I didn't come in contact with actual, a cashier, or I was actually staying away from the cashier because the cashier has been dealing with many people, right? So I just went straight to the self checkout.
Yeah.
So you have to start thinking, okay, what is the best way to have the minimal amount of contact with anyone while I'm here? So you go, you grab your stuff, you go to your self checkout, you check out your stuff, you leave. When you get in, if you have your hand sanitizer, you're going to sanitize when you get in the car because you've been touching stuff, right? So once you get in your car, you want to sanitize at that point before you get in your house. When you get in your house, you want to wash your hands. So with the masks, to get back to the mask question, when I go to work, every room I go in, I don't care why you're there. You can be there for a toe hangnail. I'm wearing a mask.
Yes.
Okay. You can be there for, it doesn't matter. I'm wearing a mask because I just don't know who you are when you walk through the door. So for people who are wearing masks outside, if it's an area that is just open air, you don't need to wear a mask, for that. If you're in closed quarters where it's a small space and there are multiple people in there and you're all breathing the same air, and you don't know who those people are, they're not in your family, then it makes more sense to wear a mask in close quarters like that. But you shouldn't really be in close quarters anyway at this point, We're saying, you know what I mean? We're saying stay home, and if you have to go out, just go out, grab what you need, and come back. So you shouldn't be at work in an office in a tight space with other people at this point, unless you're in a medical building. Right.
We got some people still going to work whose companies haven't quite cleared them out here in NJ for sure, and New York. So this is definitely very helpful. And then I have a question here from Roro, who says, is it airborne or do you specifically have to come into contact with a carrier? That's one of those truth versus myth that I'd love to hear you clarify for us.
So it's droplets. Right?
Okay.
It's basically you're getting it from droplets from an infected person, but then the droplets are in the air. So if you're within 6 feet of that person, whatever they exhale goes into the atmosphere and then you inhale it. So you see? So if they sneeze, if they cough, if they, anything coming out of their body that is some kind of a mucus, or something like that, and it goes into the atmosphere, it's, like microscopic. You're not going to see this.
Right.
So it is in the air. So if you're close to that person and that's what the whole distancing is supposed to help with, is that as long as you're staying 6 feet away, even if the person coughs, if you're not like right there, you should be protected unless you're breathing, unless you're walking into the space they just left.
Yeah.
Do you see what I'm saying? Like if someone's in line and they're standing here and they coughed and they sneezed and all this stuff is in the air and they moved away and now you come and stand where they were, if it's still there, you're going to breathe it in.
Yeah.
And now it's in your body.
Jeez.
So the social distancing is so that we're not breathing the same air and we're not in that same space. So yes, you can get it from someone, releasing any kind of bodily fluids into the air.
Got it. So that brings me to another powerful question here from Antoinette. Antoinette says, neighbors on the street behind me are quarantining together. That sounds like a block party, but I'm gonna get to that.
Not a good idea.
They order all groceries. They order all groceries together and feel they are safe. The kids play like it's a normal day. This is a concern for me. What do you say? And you say, not a great idea, right?
Yes, it's not a good idea because what's happening is you don't know when those people then leave the house every day where they're going, right? Are you doing an inventory? When they'll say the husband of the other family goes outside and comes back in. You just don't have as much control over what that other family's doing. You can't tell them what to do.
We'll be right back after these messages. Are you dealing with dry winter skin? Shea Radiance is a natural beauty brand co-founded by Funlayo Alabi and her husband in Baltimore, Maryland. She started making shea butter-based products in her kitchen to address her family's dry skin and eczema problems. She found that shea butter not only cleared the eczema, but made skin beautiful and radiant. And that's how Shea Radiance was born. Shea Radiance uses only the best quality shea butter, which is sourced directly from women-run collectives in West Africa. Using clean and simple ingredients, Shea Radiance has created a line of natural beauty care products, like their best-selling whipped shea butter. This jar of whipped butter is made with love in small batches. Pure shea butter whipped with cocoa butter and other amazing ingredients make this a rich and delicious moisturizer for dry winter skin. For more information about Shea Radiance and all of their amazing products, visit www.shearadiance.com. Great girlfriends, are you ready to go big and be connected with like-minded women who are doing the exact same thing? If that is you, then I'm inviting you to journey with me and a host of other amazing great girlfriends into The Bond, which is our private growth circle for women. Why The Bond? Because you need to be bold and brave to challenge your comfort zone and stimulate change. Most importantly, you must be aligned with excellent women at all times. So I'm personally asking you to join us in The Bond for exciting community, excellent content, and connections that you deserve to be bold and strong in every single day of your life. Join now at thegreatgirlfriends.mn.co. That's thegreatgirlfriends.mn.co. I'll see you there. So true.
If it's your own family, you have a little bit more control over knowing their whereabouts.
Yeah.
So now they show up again and they're in your house. Where have they been for the last whatever time they were out? Are you going to question them? I mean, if you don't know that and you're just trusting that people are smart, many people are smart, but they don't have common sense.
Right. Yeah.
You know?
Yeah.
So, well, at least what should be common sense?
Yeah.
So they may be out there doing whatever, and then they come back in the house, and now you're exposed.
Whew. Okay. So Antoinette, and to anyone else, any moms who were considering, having a play date because you know a family and you trust them and you figure, well, I know them and they're clean. And like you said, many people are smart, but their practices are different behind closed doors. And we don't need to risk our children being carriers. So it's just best for us to have virtual play dates like women have been doing. Shout out to all the great girlfriends around the world who have been having virtual meetups and have decided that the party goes on, right?
Yes. So, and I mean, you can still, the virtual parties look great.
That's right. That's right. I love it. So I want to get into
Get your drink.
Yes, and celebrate together that we're here, we're healthy, we're okay. Let's do that together. Yeah. So, okay, I want to get into the medicine really quickly. I've got a question here from Roro. How effective is the malaria drug for treating coronavirus? And then she has another question after that because there are some other rumors going around that there are some holistic ways that you can approach solutions. So I want to start with the malaria drug.
Okay.
Are you able to speak to that?
Sure. So actually, just yesterday, I had a patient that came in and she came in with hallucinations. And as I went in to see her, I thought maybe it was a psychiatric situation, but it turned out this woman was very sick. And I actually ended up having to put her on a ventilator. I mean, she was really sick. Her oxygen level was incredibly low. And that, I think that also was part of why she was hallucinating. She was in delirium. And so when she came into the ER, that was not the anticipation. They thought her daughter called because she was hallucinating at home. Mm-hmm. She showed up and she had a terrible pneumonia, right? So I listened to her and she sounded horrible. We did a chest x-ray and everything. And she ended up having to be put on a ventilator because she just couldn't breathe and support her breathing. So for that patient, I am almost positive that she will have COVID. Mm-hmm. I can't go into her whole history, obviously, for confidentiality and all that stuff, but just the presentation, her x-ray and all that stuff. So she got antibiotics, even though we think the culprit of all of this may have started with a COVID infection, which is a viral infection, right? So traditionally, antibiotics are not useful in treating a viral infection, right? Because antibiotics are for bacteria, not for viruses. Mm-hmm. However, what we're seeing that's happening in the cases that are severe are these people are also having pneumonia. Mm-hmm. So pneumonia, usually we treat with antibiotics. So when you're seeing people being treated or you're hearing that, people are considering using chloroquine or any of these malaria drugs is because some studies, people who have used it have seen some good results with it. Now, we can't say 100% that the results they're seeing is solely because of the malaria drug, because it's just too early. We haven't been using it long enough to say, yes, there's a direct correlation, but we're using several different antibiotics. It's not just the malaria drug. We're using Zithromax, we're using chloroquine, there are a bunch of them that we're using. We're using other antibiotics that would be for atypical pneumonia. There's a pneumonia called atypical pneumonia. We're using some of those medications as well. So I'm not sure why the malaria drug has been the one everyone's talking about, but there's several. But there's several antibiotics that we're trying on these people when they actually end up having pneumonia. So it's not that they only have COVID symptoms and then we're giving them antibiotics. They have COVID symptoms, but they also are showing pneumonia on their X-ray.
Okay. Oh,
so
that's
a
clarify.
Different subset. Yeah, that's a different subset of people. Majority of people who get the COVID infection are not going to be that severe, especially if you're young, healthy, no medical problems, and you get it, you will probably have symptoms for about 3 weeks, 3 to 4 weeks, and it'll be bad. You'll feel like crap. But you're not going to, be on a ventilator unless, something else, it's some sort of pre-existing condition, people who are chronic smokers, people who have chronic lung disease. Like I said before, at the list of people I mentioned before, you can see those people just go down fast. Now, with all of that said, there are some cases out in Detroit that just came out this week where one of the physicians out there he's doing a blog of the people he's seeing in his hospital, and young people in their 30s, late 30s, early 40s with no medical problems are also showing severe disease where they're ending up on ventilators. So it's really case by case, honestly, how this goes. You could be one of those people, one of the 113,000 people who recover after 3 weeks. Praise God for that. Or you could be someone who had no medical problems, and for whatever reason, this particular strain of virus enters your body, and you get something called a cytokine storm, which is all the biochemical things that are happening once the virus gets into your body, and you just decompensate, and within literally days, you go from having a cough and mild symptoms to being in respiratory failure.
Wow.
That's the problem with COVID.
Okay.
It is infectious, it's fast, and if you're going to be the one, it's going to really hit hard. It hits you hard fast, and if you are not in the right place to get care, you're dead.
Okay. So one last question, because I know we've got to end. Elderberry or not?
Not.
Social media is saying have your elderberry, take it daily, and I heard another doctor say elderberry is actually showing counter effects or benefits to people who
that's why I said not. So there's another study now. It's not, the thing is, the studies are being done in such small cohorts that the statistic value of them is not great. Because it's not like you're testing thousands and thousands of people over a long period of time. All of this stuff is coming out like within days, or weeks. And so elderberry and NSAIDs, we're staying away from. So NSAIDs, meaning non-steroidal anti-inflammatory drugs, ibuprofen, Motrin is the same as ibuprofen, it's just another name for it. Advil, Aleve, aspirin, all of those are in the category of NSAIDs, That and elderberry, we're seeing that people who are taking that for their fever control and, taking it for holistic reasons are ending up having worse symptoms. So like right now, when people come to the ER, we're only using Tylenol for the fever. We're not using Motrin. And so we're not using any kind of anti-inflammatory, non-steroidal anti-inflammatory for fever control. So no ibuprofen, no Advil, no aspirin, like all of that. We're only using Tylenol. Now, before we end, I wanted to just give some holistic tips, because I think it's really good for people to go through this time of stress with, just to have some tips on how to deal with it. Do we have time for that?
We got 3 minutes.
Okay.
We got 3 minutes, yes.
I can probably do it in 1 minute.
Oh, okay, perfect.
So basically, what I would say to everyone who's going through this very stressful time, or any stressful time really, not just this one, is making sure that the foods you're putting in your body have a lot of antioxidants in them. Okay, because the antioxidants are going to remove free radicals from your body. And free radicals is what causes inflammation. Every disease process starts with inflammation. Okay, so if you reduce the free radicals in your body by eating foods that are rich in antioxidants, foods like avocado, foods like any kind of seafood, really, fish, or even taking fish oil supplements, all of those berries. Berries are low in sugar and have a chuck full of antioxidants. All right, so eating things like berries, fish, avocado, nuts, all of those things are very rich in antioxidants that will help you to at least increase your, anti-inflammatory response. Okay, so you want to do that. You want to get adequate sleep, and that means 7 to 8 hours of sleep. You want to hydrate. Okay, so we're talking somewhere between 70 to 80 ounces of water a day. You want to make sure you're not around negative people that are going to increase your stress or increase your fear or anxiety. You really want to keep your stress low during this time, because there's so many things already that are stressing you. So you don't want additional factors coming into play. So people that are negative, stay away from them. And then just think about the things in your life that you're thankful for. Like we talked about at the beginning, gratitude. Have a gratitude practice. Pray, read your Bible, meditate, anything you can do that's going to basically bring you back to center. Yeah. Exercise. I'm going to plug in exercise.
Yes. And you should. Yeah.
Yes. Exercise is going to reduce your stress and improve your immunity. Probiotics, make sure you're getting that, okay? Is going to improve your gut health, which is where about 70% of your immune cells are formed. So if your gut is healthy, your immunity is stronger, okay? So all of these things are important, holistic ways that you can basically, get yourself in the best condition when you're going through a stressful time. And then mindset, just looking at the perspective that you go into these things with. Are you an optimist or are you a pessimist? Do you make everything, be negative? Or do you look at the sliver and the glimmer of hope?
Right.
To find the good in it. The good in what's going on right now is we're actually getting to know our kids.
Yeah.
We rarely see them. I know I didn't see mine. Now we're getting to know them. We're spending time with them. So that's the good in it, right?
It means a lot coming. It means a lot coming from you, a medical professional, to say, find the good in it, because you are seeing the worst of the worst right now. So for you to remind us of that should really say, when you're hearing from a frontline soldier, keeping gratitude and having a practice of gratitude and finding the good in these dark moments. I think we should all take heed to that. I think it's very valuable to hear it come. It's easy to hear it said from me. I work from home, but to hear it being said from you, and you're out there every day and you're seeing so much and doing so much to help bring things to flatten the curve. Language that I think that's important for us great girlfriends to really recognize, and hopefully even by taking note of what you said, Dr. Dianah, we can see the ways that we can take ownership in the solution. A part of the solution sits with me. It sits with you. It sits with everyone that's listening around the world. Locate yourself in the solution. Find a place. She gave us a list of things that we can do on a personal level to really keep our lives on track. But also she gave us solutions that we can use when we are externally connecting with people. The social distancing is not an option. It's just mandatory for us right now, and for us to have a different level of consciousness, not just to be smart, but have some street smarts, have some have some common sense. And if it feels uncommon to you, still practice it until it becomes natural. But the point is,
Yes.
let's all be a part of the solution and locate ourselves in the solution. I think the biggest thing that I've gained from you is that you're able to give that to us, takeaways that we can utilize. And also, another part of the solution that we can offer to you is prayer and support, knowing that you have an army of women who are standing behind you, even though you can't see us all. We're
Thank you.
cheering
I
you
need
on.
it.
Yes, I know. We're cheering you and every single
Thank
healthcare
you.
practitioner and military and elected officials and teachers and people in government who have to make very difficult decisions right now. We are praying and covering all of you, that you have the grace of God to do what is essential right now, and it's in the best interest of our country and our world. So just know that you're not alone.
Thank
You
you.
are surrounded. So, where can they find you for those that are going to be looking you up online? Because there's so much that you can learn from her in terms of fitness, holistic health, wellness in general, and even your work and your fight against autism. Where can they keep up with you on social media?
So they can find me at Dr. Di Fit Life. That's DrDiFitLife. So I have a public fitness page, and that's the Dr. Di Fit Life page. And the website is the same. It's the drdifitlife.com.
And again, I can't thank you enough for this time, because I know your time is very precious always, but particularly right now, it's so limited. But I hope that we are grateful from around the
Thank you
world.
so
We
much for
say
having me. This
thank
was great.
you. Thank you. Thank you. Thank you. Great girlfriends, did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast, into the community. Speaking of community, make sure you join our Facebook group, The Great Girlfriends. You follow us on Instagram at The Great Girlfriends and on Twitter at @the_great_GFS. Last but not least, we'd like to thank my amazing husband, Kwaku, Sam and Dilly, and all of you for being a part of the global community that makes us so strong. Please remember to share with your friends. Keep listening and keep being a great girlfriend. I'm Sybil Amuti, and I'm out. Peace.